Hey, what's up guys? We have a great patient in the house named Sari. Sari came in with, what were your primary complaints?
Shoulder pain, neck pain, and wrist pain as well.
Wrist pain.
Yeah.
For the wrist pain, previously we had what kind of treatment?
Cortisone injection.
Cortisone injection.
Yep.
So an anti-inflammatory, kind of a shot in the wrist to help reduce pain. Was not given any kind of rehab stretches, exercises, is that correct?
Yep.
All right, so he got referred to our clinic because he was having some discomfort up here in the neck, the upper back. This is his, I guess maybe 7th or 8th appointment by now?
Maybe fifth.
5th, okay, 5th appointment. How have you felt since you started treatment?
It's a great change. Yeah, it's a big change actually. I'm not actually. I had numbness in my left arm, and now the numbness is gone. The pain is much less, and it did not go away completely, but it's much less than before.
Nice. So
Wrist is still in progress.
right wrist is still in progress. So we uncovered some cool stuff in between Sari's back arm line and his front arm line. And the front arm line are the muscles that come down from the front of the hand up through the chest and over down to the opposite side. The back arm line are your extensor muscles that come from the top of the fingers up through the elbow, through the mid back. And so one of the things you guys have seen on previous videos, how we want to have a strong back line so that we have good posture, we have nice back chain dominance, which is going to eliminate his complaints of numbness, tingling, pain, tendinitis, and tenosynovitis, which we'll see on his right wrist, which is actually his more damaged wrist, but he wasn't aware of that before we started treatment. We actually didn't uncover it until his probably 2nd or 3rd appointment when we said, let's check how the back arm line stretches, and he... What were your symptoms?
Yeah, I got lightheaded.
Very lightheaded,
yeah,
with just a wrist position. So his brain has pain down here, but he forgot about it. He had a cortisone injection because he had some uncomfortability down in the right wrist.
Mm-hmm.
Came in with left side neck pain. We start to balance the system out, and then we uncover that he's got a deeper right wrist issue that he didn't tell me about on his first appointment because it really wasn't relevant to his left. He didn't think it was relevant to his left neck pain, right?
Yep.
Cool. So when the front and the back arm lines get imbalanced, we can get scoliosis or a little curvature of the spine. The rib cage starts to become imbalanced. The vertebrae throughout the body start to get twisted. And I don't care where your pain is at, I care about balancing your entire system out. What was that other improvement that you mentioned? Was it energy?
Oh yeah, energy. I feel more energetic now.
More energetic. So when we reduce stress, inflammation within the body, within the nervous system, the brain can talk to the body better, and then we just naturally have more energy. That's one of the awesome benefits of chiropractic care, and uncovering and actually fixing your old injuries, not just taking a pain pill, a painkiller, an anti-inflammatory, a cortisone injection, which tricks your brain into believing that pain's not there. The brain gets numb to the pain. It says, well, I'll forget about that. I'll move on to somewhere else. And then we uncovered he almost passed out just with a slight wrist stretch because his brain said, holy cow, I still have a ton of pain there, but you haven't put me in a position that stressed it, so I forgot about it. Cool?
Yeah.
Scooch forward for me. All right, and now let's work to get hands right at our side, right here. And one thing we're working on with Sari is getting him to become a little bit more extendable, a little bit more extension through the thoracic spine, and a little bit less, if you want to come from the back and just look. And we see how in this position, how his left shoulder is just slightly rolled forward than his right shoulder. And we also see in the back of his neck over here on the left side, how it's more contracted than the right side is, okay? Right at our side, let's move him right here. Let's straighten elbows gently, nice, and now let's roll shoulders back, okay? So guys on camera, what I look for is how well he can cut on this right side and how the left side cuts. And already you can see just with this back power up, how he has less compression up here in his left side neck. Let's look straight forward. Chin tucks backward lightly. You may feel some stress up in your neck by doing this. And guys, what we're looking at again is just like this little bit more compression on the left side versus the right side. But Sari, when we say coil to the right, and in your brain you're focused on gently squeezing right through here, let's grade that, and then let's test it against this. And is this side a little more difficult or easier?
It's more difficult.
More difficult, right? So he easily or more easily can feel in his brain the right side lat. Do you have wrist pain on the right side here?
A bit, yeah.
A little bit. How about if we straighten the elbow up a little bit? Nice. That's tough. So it's tough for him to get full extension on the right side, full tricep back chain activation, which we're going to work on. Now let's test left side, but straighten your left elbow. Oh, nice. See how well this left elbow straightens? So he does have a little, how about if we grade the tricep? If I say squeeze this tricep, and now coil back into it, and focus on that left elbow. How does that feel? Lock this out a little more, and roll this back a little more.
I feel pain in my forearm.
Pain down here in the forearm, okay? But you feel these muscles kind of working a little bit?
Yep.
Now let's try to go to the right side with right elbow straight. Oh, and he can't even get this right elbow locked out, so there's less tricep. Let's show the left side again. And we're looking at how well this tricep fires and the elbow extends, and this side's good. See how bent this side is, and he can't due to wrist pain. So he's got some stuff going on in the right wrist that we got to clear out. We're going to do a little soft tissue treatment down there very gently today. But gradually at home, Sarah, you're working on 20, 30, 40 minutes a day of just back chain sitting, okay? Adding in 30 seconds of a coil left, feeling how there's clunky stuff all around the shoulders, which is going to dissipate, feeling how we coil right. But you do have better connection to the right lat than the left lat, but you have better connection to the left tricep than the right tricep. So different injuries mess up our system and make muscles fire at different rates, and then we end up with pain in different areas, okay? Now when I check his right trap, it's nice and loose. When I check his left trap, it's not nice and loose. He's holding a little tension up there, so we're gonna clear it out with the hyperpole. And I just want you to focus on a breath in and a breath out. So Sari's moved here just recently. He's been working on, kind of like as an auto mechanic, he's been working on a number of cars, is that right?
Oh, yeah.
Kind of like rebuilding and fixing and getting stuff back on the road, is that correct? Lots of mechanics, lots of people that work heavy manual labor have to put their bodies in tough positions. We've talked about how to start stretching so that he can bend over an engine bay correctly and help to create better strength in the body with less risk for injury. That's one thing we've discussed with him on his appointments. Second thing we've discussed is how to start to take control of your posture at home so that you can develop more power in the back and less compression in the neck. We don't want to be kyphotic. We don't want to be compressed up in the CT junction. We don't want to be having neck pain whatsoever. Originally, he was having numbness and tingling down into the left arm, which is more so centralized, and pain centralization happens as if you have a problem down in your fingertips, that's where the nerve or group of nerves is lit up. It's irritated the whole way down. That's like no good. That's worst case scenario. We want to see, one, a pain reduction. We want to see, two, more centralization of pain, which means it comes up the arm, and maybe the arm health improves, but the neck and the upper back still are a little sore. Repetitive treatments, muscle work adjustments, laser therapy, as we're going to do on Sari today as well, helps to reduce inflammation, irritation. Ultimately, we're working on getting his thoracic spine to be more extendable, more back chain dominant, holding his head up at a higher rate so that he can have more breath, more oxygen into his body, and a better sense of empowerment through posture. When you're empowered through your posture, pain goes away. If you are stressed out all the time, your posture starts to stink, your pain increases, and you continue, or maybe you do, continue to pop ibuprofen or Advil or something that does not fix the pain. It masks it. It makes you think, oh, I'm out of pain if I just take these more pills. Well, hey man, my motto is live empowered. Let's take control of your body. Let's get you to move the right way, bend the right way, stretch the right way. You okay?
Yep.
Good. So you'll hear me ask patients, are you okay? Because everybody senses and feels discomfort in a different way. Some people are very sensitive to pain. And if you're sensitive to pain, oh, you can get a little woozy or lightheaded, even just by using the hypervolt. All right, nice. Now, next step. We're gonna transition to a knuckles down, a light, super light knuckles down. All right, Bree, come take a look at this. Okay, just wait, just wait, just wait. All right, guys, so what we're looking at, the left hand, he can get knuckles down flat. Don't push too hard. The right hand, he has some fear, he has some injury. He's got a ton of tension on the top of the right wrist that we need to work out. He's kind of scared to put the right hand down.
Oh, yes.
Yes, because it hurts so dang bad, right? So let's move out to the side lightly. And now let's start a little easier right here. But let's actually raise this wrist up and try to balance. And can you apply a little pressure down through it? Is that okay?
Yep.
Nice. Now let's find your back chain, correct. And let's notice back here how low this right shoulder is and how tighter this left shoulder is, okay? Now if I say push a little harder through the left hand, roll the shoulder back a little bit, straighten the elbow a little bit, nice. That's where I want you to hone in and find the tricep back here, okay? Now can you push a little harder through the right hand? Can you work on this right elbow? Where are you tight at here?
It's almost here, I guess.
More out here. Correct. Breathe in, breathe out, roll back lightly. Nice. So if I say coil lightly, you're going to work on that. And if I say coil lightly, you're going to work on this week. Now this is a little bit of a new position we didn't talk about. We also need to, come back here, Bree. We also need to notice how these are 90 degrees inward, these are not. Can I turn this a little bit inward like this? Good. Can I roll? Nice. And now notice how this side feels. Notice how this side is still a little tougher.
Yeah.
Focus on this left elbow. Okay? You see how this feels? Can you work this at home this week?
Yep.
Nice. Straighten the elbow, roll the shoulder back. Nice. Now let's work on the right side coil with a little bit of right elbow straight. Is this much tighter up here?
Now it's okay.
Now it's okay. So it kind of worked itself out, which is good. All we're doing is greasing the tendons, the muscles. We're training the brain to become bilaterally strong. Let's notice one more thing, Sari, how this thumb is tucked, but this thumb is not. Can you push this thumb down? Just like this one. So be very mindful this week about a soft raise. Oh, and let's relax. And let's go right here. And now what I want you to do, Sari, shift this way. Oh, gentle. You okay?
Yeah.
And now shift this way. Notice how that's easier.
Yeah.
Now just a light shift here. Oh, good. Hold it. A little bit of pressure down if possible, but not too much, just enough. Now back to center. Now how about, can we roll these open a little more?
That's right.
Yep, you can do that. Nice, nice, nice. Hold right there. Guys, on the camera, notice how in this position, left elbow's locked out, but right shoulder goes high, right elbow's not bent. Let's inhale deep, exhale, think tall, sit out of the spine, and roll shoulders back like, nice. All right, now focus on right elbow, straight. Oh, good, good, good. Focus on right tricep. Focus on right shoulder back a little bit. See how you're gonna work right here for me? Does that feel okay?
Yeah.
And now left side. Good, that's a good coil. Feel it down into here. And now right coil. Oh, see, we need a little more right coil here. A little more pressure down through the knuckles. You okay?
Yeah.
All right, rest right. If we feel any tender spots, I want you to say right there. If we don't, that's great. Right there's a little one.
Yeah.
Up here, maybe in here. Focus on the shoulder back lately.
Yeah, it's exactly
Right there.
Yeah.
You okay?
Yeah.
All right. Just breathe in, breathe out. Oh yeah, right there it is.
Yeah.
All right, relax. Let's go to center. Let's go knuckles back. Ah, all right, let's go strong. That's strong wrists, okay?
Yeah.
Now strong wrists turn into strong back, correct. Now just in this position, chin tuck. Nice, and now head up. And make sure we relax the neck here. Feel how this side feels good?
Yeah.
Feel how this side is not as good,
Yeah.
correct? So now we got to clear out a little bit up here in his neck where he's a little stiff at. and he feels this big bad guy. And I just want you to lightly focus on your hands. Now look down. Oh, sorry, right there. So we've got a couple areas, a couple levels, cervical levels up in the cervical spine that need cleared out. And he's got a big tender spot right here. And that's where nerves get compressed. So you have multiple levels of nerves up in the neck, the occiput, the C1, the C2, 3, 4, 5, 6, 7, and then there's a C8 nerve, but there's not a C8 vertebrae. Then you go to T1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and then you've got L1, 2, 3, 4, 5. So cervical spine's neck, thoracic spine's mid-back, lumbar spine's low back. Look down. Now remember, Sari came in with left side neck pain.
Yeah, it's all over.
It's all over. He wasn't aware that things were twisted. And on the left side, he's got some occipital and SCM and suboccipital tension up here around 2-3, C2-3. Right side, it's more 5, 6, 7. Left side, it's like CO, C1, C2 that's a little compressed. Right here. Just relax and wiggle. Good. Tall sit. Exhale, shoulder blades back gently. Right elbow straightens up tall. Nice. Correct. Now you're super soft up here. See how this feels? Now if I say left coil, if I say right light coil, left light coil, 20, 30 seconds left, 20, 30 seconds right. Got it?
Yeah.
Back to center. I'm going to pick your wrists up. You're going to reach them back. Oh, relax for me. Hold right there. You okay?
Yep.
Left elbow's long. Right elbow. Oh, there we go, my man. Hold in, breathe out, focus on right here. Squeeze and straighten. Nice. Shoulders gently back. Now neck stretches to left. Chin down. There we go. Let it go out of your neck. You okay?
Mm-hmm.
Good. Breath in, breath out. I'm going to help him just open this up a little bit. Straighten your right elbow lightly. Focus right here. Squeeze that right tricep. You can't do it? Okay. See the definition of the right tricep? Now let's go neck right, head right. Squeeze the left tricep. Oh, feel how much stronger it is right off the get-go? Left tricep has this nice long head definition, medial head, lateral head of the tricep. He's got this nice definition. We got to work on reattaching him to his right long head of his tricep, which is not fair. Shoulders back, back. There you go, correct. Neck down, let your head hang for a little bit. Breathe in. Does that pull up here into your neck a little bit?
Left side.
Left side more so, up high or down low?
Down.
Down low, down here.
It's
Right in there?
Yep.
Okay, let's do just a little treatment to the neck today. There it is right there. Tilt your head to the right gently. I know it might feel like the skin is getting cut, but it's not. Is it sharp, huh?
Sorry.
Nice. Now head to right. All right. That's good today, bro. All right, guys. So other thing we have Sari doing, he's working in the gym a little bit to learn some more advanced training to help him progress a little bit faster. And some things in the lower body that we notice is that the left heel is a little more shock absorbing than the right heel. The right foot's a little tighter, just a little bit. And you see when I torsion or twist this right heel, how it twists and torsions the whole spine. But when I do the left heel, it's just slightly less. This side is just a little tighter, it pulls a little tighter. So let's get him adjusted. So much better in your mid-back. He used to have left shoulder, right rib cage, which is still a little apparent, but way better. Deep inhale through your nose. Exhale down, shoulders down. 1, arms down. 2, nice, breath in. Exhale down, shoulders down. Beautiful. Breath in. Exhale down, shoulders down. 1 more. 2, breath in. Exhale down, shoulders down, relax mid. Nice work. Now we're gonna do upper one more time. Inhale deep. Exhale down, relax shoulders and chest down. There we go. Face over to right side, feeling. Head goes straight up like this. There we go. Breath in. Exhale, roll. 3, 2, relax. Nice. 1. Other side for you. Now, great thing about him, his core is functioning, which means his low back adjusts easier than some people. Here, here. Breath in. Exhale, roll. 1, 2, 3. Flatten your back for you. Hands on thighs. Correct, right there. And then we notice when we do his plantar flexion that just right off the get-go, this whole right leg is a little stiffer than this left leg. Feel how this feels here? Good or bad?
It's good.
How's this feel here?
It's tight.
Tight. So we feel a spot right here on his second, third toe. Now we're not going to work too much on that today, but as we get a little deeper into the wrist finger treatment, everything on this right side is connected from the right wrist, right fingers, down through the right foot. Nice, nice, nice. One here, relax. Nice, and left foot. And now left cuboid is good. Left knee, bend. Nice, double. Now right side. Relax right toes. Tight, tight. Three out of 5. Gently put hands on thighs. Gently squeeze left toes down. Cramping or no?
Yeah.
A little bit.
Mm.
Gently squeeze right foot down. Cramping less or more?
More.
More. Left side. You gotta lay in bed every night. Left foot squeeze for 20 seconds. Right foot squeeze for 20 seconds, okay?
Mm-hmm.
This side's gonna cramp more as these bones that are sore right here reorganize downward. Got it? This foot is weak. We need to focus on the grip, power, the plantar fascia. Good point about orthotics and footwear and stuff like that. Better to go barefoot. Better to go barefoot so you develop arches of your feet. Sometimes I wear my Vivo barefoots. Sometimes I go shoes off in the office. Relax here. There we go. Oh, not yet. Well, I got 2 more out of it just with one little back chain activation. Now toe squeeze down on the right. And you're going to hone in and you're going to focus in on this long energy down to the right foot. And then you're going to hone in on this left energy down to the left foot. Okay? Cool? Relax right there. Gently touch your feet together. Hold them right there for me. Relax right in. Nice. Did we get that yet?
This is the first time, I guess.
All right.
Mm.
Oh. Nice. Nice.
Yeah.
Not elbow yet. Hold right there for me. First time it's adjusted. So he was all jammed up on his right side. Your bones get compressed. If your bones are compressed, you get arthritis earlier. Right finger on the middle, we gotta work. Thumb, relax. Nice. Now left elbow. Relax there. Okay, roll open. Bend elbow. Bend, pull into my hand. So if, you're gonna bend this way. There you go. Pull, pull, pull. Now stop. Stop, stop, stop. Shoulder rolls open. Good. Elbow straightens. Good. Now bend elbow. Now relax. Now roll. And that's what your body's gonna sound like after we get you adjusted. Car guy right here. Relax your hand again. Nice. Just another check. There goes one more, another adjustment, elbow. This side's tough, yeah?
Yeah.
Okay. Roll shoulder open. Correct. Breathe in. Breathe out. Let hand relax. Where's this tight at? All through?
And the wrist.
The wrist mainly? Okay. Scar down here. Did you or no?
It's a carpal tunnel thing.
Carpal tunnel surgery.
Yeah.
No good. Helps temporarily relieve pain, numbness, tingling. Long term, more tenosynovitis, connective tissue dysfunction, wrist immobility, lack of muscle, fascia, connective tissue stretching. You okay?
Actually, after the surgery, my wrists got weaker.
Got weaker?
Yep.
Did it really? 70% of the time, that's what I think the stats are. Oh, carpal tunnel surgery works. It relieves your complaints of numbness, tingling,
Yeah.
sometimes lack of circulation. Surgery doesn't work. Mindfulness, body positioning, muscle balancing, skeletal balancing. Problems come back somewhere else. Could be the neck, could be the shoulder. Sari did not come in here saying, my right wrist needs help. He said, my left neck needs help.
Mm-hmm.
But really, the right wrist we see is the one that he can't bend well. Relax your fingers. You okay?
Yep.
Roll your shoulder back and open lightly. Correct. Out here more?
Mm.
All over.
It's yeah, here, I can feel it here.
Over there too. Okay. Good. Relax for me. Oh. And up here. Relax your. Not yet, but we'll get it. Hands here. Shoulders open. Last part today. Neck. Easy on the left. And then over here, shoulders down. Nice. And one more here on the left. Relax that left. Let's get this a little. There we go, buddy. Okay. Right arm up. Relax elbow. Relax arm. And now left arm, left elbow. Relax arm. Relax shoulder. Oh, there's that one. Let's try this one now. Relax elbow, bend it. Not yet, not yet, that's okay. You okay?
Yep.
Cool. Knuckles down. Ah, come back here. Well, at least we got the wrist flat from the beginning.
Right, this one?
Yep.
Yeah.
But left elbow straight, right elbow's not. We got more front chain work. We got more back. Yep, find that. Oh, good, dude, right there. Look at that. Piece of cake now. Couldn't bend the right wrist. Now you can bend the right wrist. Don't become a victim to your injury.
Yeah, I can feel the triceps.
You feel the tricep.
Yeah.
It's coming back. Now hone in on it. Now squeeze this tricep. It's going to cramp gently. Okay? Now left side. Open. Now coil lightly. Now coil lightly. Oh, now center. Now don't tilt the head. Lift the head up tall. Make sure we don't carry this tension up in the right side neck that we just cleared out. Look down over here. Tricep. Nice, dude. You okay?
Yep.
Good. Now this stresses the nervous system. We just put them back into a little bit better place. You got to work on this at home today. 20 or 30 minutes over the weekend. Let the head hang. Let the neck stretch. Let the neck stretch. Raise the head up. Tuck the chin back. Tall sit through the shoulders. Raise the chin up. Relax the neck here. Especially right through there. See how this side moves? Especially right through there. Nice. Back to center. Look left. Look right. Tilt left. Back to center.
I can feel it now, actually.
It's connected.
Yep.
Cool. Thanks for the appointment.